sneaking in the middle of the night and grabbing the garbage bag full of medical waste and taking it out to their van and then selling it in the parking lot. Really blank stares. Crowning, we have that ring of fire. Then when things do get real and things maybe go to for you really long, like Lieutenant Dan.
But you ain't got no legs, Lieutenant Dan.
It is time for more Nobody Told Me That, and this one is all about childbirth. So welcome back to the series Nobody Told Me That, where I am going over things that nobody told me, and so I bet nobody told you either. And this one, I'm going to tell you the 5 things nobody told me about when it comes to childbirth, starting with the placenta. The placenta is something that is so important to your pregnancy journey, but it's something that not everybody will talk about. And then when I say, okay, it's time to deliver your placenta, I get a lot of really blank stares. Because yeah, after you have your baby, you have to birth your placenta. So let's rewind. Let's talk about what is the placenta. This is the placenta, if it were actually in your body. And this is a really cool organ. It's actually made out of the same cells that are forming your baby. And it's formed very early in pregnancy. And then it becomes a fully functioning little traffic system that takes things like oxygen and nutrients and antibodies to your baby, but it also removes waste products away from your baby. So really, this one's the highway of life that keeps your baby doing the things it needs to do. You actually have to give birth to this after you give birth to your baby. And this is going to come out the same way that your baby came out. So if you had a vaginal birth, you are actually going to have to give us a small little push once this comes off the uterine wall and actually deliver it vaginally. And during your C-section, if that's the way your baby decided to come out, your provider or the surgeon providing the surgery, they will actually manually remove this from inside of you once your baby is born and that cord is clamped and cut. And the other thing that a lot of people don't know about is that you can actually ask to see this. You can ask for a tour of your placenta. And I really suggest that you do because I think it's really cool. But I will say this disclaimer, if you're squeamish, it's might not be for you because it really is an organ that just came out of your body. But if you ask your nurse or your provider, they will show this to you. And what they will show you is this actually has 2 distinct sides. So this side of your placenta is going to be the rough side. The rough side of the placenta is mom's side. So this is where the placenta was attached to the uterine wall, and that's where that exchange is happening, and that's how this organ is actually kept alive. And then if you flip it over, it looks really different. This side is going to be the smooth side. The smooth side, this is your baby's side. So your baby was here, the umbilical cord attached to the placenta, and then of course the other end of the umbilical cord attaches to your baby, and this is nice and smooth. And then the amniotic sac kind of came around like this and contained the baby and the umbilical cord all on this side. They use it kind of like a little pillow. So 2 distinct sides, and then there's this transportation system. It's just a really cool organ. A lot of people also ask me what happens to my placenta after I deliver it, and there's a few streams that your placenta can go down. The first, I would say more common stream would be that this is actually discarded. This is incinerated as medical waste. Poof. It no longer exists anymore. And no, the hospitals are not selling them to high-end cosmetic companies for large sums of money, nor is your doctor sneaking in the middle of the night and grabbing the garbage bag full of medical waste and taking it out to their van and then selling it in the parking lot. That is not happening. Okay, I see you. The next thing that can happen is you can ask to take your placenta home. Now, a lot of sites will actually have you sign a form because you are essentially taking a body part home with you. But it's really simple. You're going to sign your form. You're going to grab your bucket. You can bring your placenta home, and then you can do whatever you like with it. The thing that I really love that people do is they'll like plant it and put a little tree, and it's like your baby's tree. Oh, so cute. Anyway, and the other thing that might happen is if there's something going on with the placenta, let's say you have gestational diabetes, you have preeclampsia, maybe you have an infection that was brewing, they're going to want to actually test your placenta to get some information on it about you and your health. So that's the other thing that might happen to your placenta. We will let you know if this is going to the lab for testing. Next thing on my list, no one told me that I could say no as long as I understood what that no meant. So here on this channel, we talk a lot lot about birth trauma and informed consent. My name is Tina. I'm a certified perinatal nurse. I'm also a certified breastfeeding specialist, and I'm a mom of 4. I've been doing this bedside nursing thing for like 17 years now. If you're new here, welcome to it. Please consider subscribing so you can come on back for more info just like this. If you are not new here, thank you so much for coming back. But this is an important one because I think a lot of times, especially in the hospital, information is kind of provided with this power dynamic that is not always equal. Because like you're laying in the bed looking up, and then you have a provider, somebody who's in a position of authority, somebody who is an expert. They are giving you information. They're kind of standing over you, looking down. And a lot of times, if you don't know that you can say no, if you understand the risks and the benefits, then they sort of feel like, well, hospital policy is law, and that's what they're telling me, so I better do it. So it's really important that we understand, even if you weren't told this, that you can say no. But let's talk about why it's important to understand what your no means. By now, it's been drilled into us that hospital policy is not law. And if you haven't heard that yet, come here. Hospital policy is not law. However,
I knew there was a but. Wait, what?
Hospital policy, it has its purpose because it's there as a guideline, and that guideline is based on best practice and science and evidence, and it's designed to keep you and your baby safe, but also to protect your provider. Now, we know that you have the right to say no to absolutely anything that's requested to be done to your body. That is your right. However, it is also your provider's right and their responsibility to really explain things to you in a way that allows you to give true informed consent, which means they need to explain both the risks and the benefits before you can say no, and you can say no knowing that you know everything involved in that no. You see how it's really important to know what your no means. Of course, you could be like, bah, get out of my room. I don't want to hear what you have to say, but I really encourage you to hear your provider out if they are suggesting something that makes you feel a certain kind of way. I think it's in your best interest to gather up all of the information before making that decision. It's also empowering to know that no is a complete sentence. It's empowering to know that even if you said yes first, you can change your mind at any point in the timeline, and then you can say no. Changing your mind is absolutely okay. Your body, your choice. It's also important to have somebody there with you that knows your wishes and is strong enough to advocate for you in those stressful or those vulnerable times. But it's also important, if they are your advocate, that they are there to hear all of that information and hear the risks and hear the benefits and hear why it's important in this moment right now. Third thing probably nobody told you is that there's actually a spectrum of pain control when it comes to childbirth. It's not like an epidural so you feel nothing, or no pain control so you feel absolutely everything. There's actually a spectrum of pain control options. I'm going to go over them briefly in this section, but I will link a video up top that is more in-depth about your pain control options during labor. There's actually 5 of them. The first one, with minimal if no risks at all, would be your comfort measures. These are the things that you are going to be learning and practicing through your pregnancy that are going to be utilized as coping mechanisms as you kick into active labor, transition, and during childbirth itself. Now, the practice part is really, really important, because if you are not practicing these things that you're going to want to utilize when things get real down the line, then chances are you're going to have a little bit of trouble coping. Now, that said, can you just roll into labor and delivery with no practice, no prep work, and can you have an unmedicated birth? Yes, absolutely you can. You can do absolutely anything that you put your mind to, but you will likely see more success if you pick out the things that resonate with you for comfort measures and you really practice those all the way through the pregnancy, because then when things do get real and things maybe go to for you, then you can sort of rely on that muscle memory. You can rely on the fact that your body knows what to do because you've practiced it and you've prepared for it. Next up is nitrous oxide. This is the same thing they use at the dentist. This is your laughing gas. Now, the really nice thing about nitrous is that there's not a lot of prep that needs to go into it. You don't need like an IV before you can utilize it as pain control. You just need the canister brought in, and then you need to be handed whatever you're going to use to get that nitrous. Now, this is either going to be a face mask that goes over your mouth and nose, and you just breathe in and out as you normally would when you need it, or it's going to be like a little pipette looking thing that you sort of suck on so you can look like that caterpillar from Alice in Wonderland. You'll be looking real cool while you use nitrous. There's also IV medications. These are going to be narcotics like morphine or fentanyl or Demerol. Just depends on whatever your site uses. Now, these medications, they go directly into your bloodstream via an IV. So you will need that IV needle before we can give you these medications. And because it goes directly into into your bloodstream, it provides you with pain control through your whole body. So it is not targeted to just your contractions. Again, like the nitrous, IV medications will sort of take the edge off the top part of that contraction where it's the most intense, going to bring down the intensity of the peak of that contraction. But because those medications are going into your entire bloodstream, it also gives you a bit of a dissociating effect. You're just sort of less bothered by the contraction than you would be without that medication. However, this one comes with more intense side effects because, again, it's going directly into your bloodstream and it is circulating. The other thing you need to be aware of with these is that if these are given too close to your baby being born, usually we like 4 hours where there's no medication that's been administered, then your baby might come out a little bit sleepy because, again, this does cross through the placenta. So your baby is going to be feeling some of those same effects that you are feeling. So sometimes babies with narcotics that have been administered during labor, they come out feeling a little bit sleepy. They need a little bit more help to transition. So if we know that you're taking these narcotics in labor, you might have a few extra staff members there just to make sure baby does great when they come out. There's also local anesthetic, which a lot of people don't know or don't think about as a pain control option for childbirth. This, of course, is a local anesthetic or a freezing agent injected into the skin. Most commonly, we will see this if you had an unmedicated birth, you push your baby out and you had a perineal injury. This is injected before that injury is repaired. This should always be given before an episiotomy, but there's also another way that this can be used during childbirth. This is known as a Pudendal Block. So sometimes if you're having an unmedicated birth and you get to the point where baby is crowning, we have that ring of fire that is happening, that burning pain that can be really, really hard to push past. This Pudendal Block can actually be given that can help numb that ring of fire feeling so that you can just efficiently push your baby out with less pain. Now, I will say not all providers are comfortable doing Pudendal blocks. So if this is something that you want to look into and talk to your provider about, make sure that you do it ahead of time. And also the needle for a Pudendal block, it's really, really long. So maybe if you're getting a Pudendal, just put your blinders on and don't look at the needle because it can be really, really effective. This medication is injected into the pudendal nerve, creates a nerve block, can really be helpful during childbirth. And lastly, probably the most common method of pain control in childbirth is your epidural. Now, I have done a ton of videos on epidurals, so I'm going to pop one up top. That is what to expect if you do get an epidural. Because we're talking about epidurals, nobody told me that you can actually reposition when you have an epidural in labor. Actually, it's encouraged to reposition when you have an epidural in labor. Now, there are some older studies that said that when you get an epidural, it's going to slow your labor right down. And that is because epidurals used to be very, I call them clunky, very heavy epidurals, where you get the epidural and then you cannot feel your legs. And you have to just kind of lay there because you can't move your legs like Lieutenant Dan.
But you ain't got no legs, Lieutenant Dan.
And then you can't reposition, you can't feel any pressure. And so, of course, that is going to slow down the labor process because your pelvis is just sitting there in one position while your baby is not, and your baby is trying to get down into that pelvis. However, nowadays, with advances in technology and advances in practice, epidurals are usually really, really well functioning. They should allow you to have that pain control so you're not feeling any pinching or any sharp pains while still allowing you to move your legs. No motor block is present. You can still reposition in bed and you can feel pressure so you know when you're contracting and you can push more efficiently with your epidural. So if anybody tells you like, oh yeah, you have an epidural, so you're going to stay in one position, that's absolute garbage. We should be encouraging patients with epidurals to continue to reposition. In fact, as long as the bed is underneath you, there's probably no position that I'm not comfortable to try to get you in. Yes, that includes all fours. Yes, that includes squatting. Yes, that includes your Captain Morgan or your lunge. We can do all those things with a well-functioning epidural. So this one's really important on the list for me because a lot of people didn't know this, but I want you to know this. Movement with an epidural is not only possible, but it is encouraged. Now, what do you do if you have a heavy-handed anesthetist who gave you the epidural of all epidurals and you feel absolutely nothing? Well, there's a couple of things that you can do. First off, you can actually ask for that epidural to be turned down. And people are always like, Tina, I don't want to feel anything. Why would I want that epidural turned down? Because again, a well-functioning epidural should take away that sharp and that pinching pain while still allowing you to feel pressure. That is the point of an epidural, to relax you and take away some of that pain while still allowing you to participate in the process, move your body, and feel that pressure so you know when you're contracting. So you can ask them to turn it down without suddenly feeling an onslaught of pain. It's absolutely possible. The other thing that you can do if you are loving feeling absolutely nothing down below, you can sort of throw caution to the wind and you can allow your staff and your partner to sort of reposition you for you. Basically, we become your legs. It is possible to reposition somebody who can't move their legs at all. It takes a little bit more finesse. It's a little bit more awkward for sure, but we can get you there because laying on your back in one position with a heavy epidural, that is not going to help anybody. And lastly, I love a birth plan. You know I love a birth plan. I look at your birth plan and I think, oh, well, look at this. This person really, really took the time to think about what they wanted in their birth experience, and they did the prep, and they did the preparation, and they practiced. They did all the things on their end that they can to try to really secure that positive birth experience. However, I wish more people knew that where you give birth and who you give birth with can really affect how much that birth plan can come to fruition. And let me tell you what I mean here. If, for example, you wanted a water birth, you loved the idea of a water birth, and you showed up to give birth, but the facility that you showed up to give birth at, they don't have birthing tubs, and they don't allow you to bring in your own birthing tub. Well, that would really cause you issues in obtaining that water birth. Or let's say you found a place that has that birthing tub, but then you show up and you want a water birth, and the provider that you're working with that day, they say, oh, I don't actually do water births. Again, this would throw a wrench in your plan. Another example would be a VBAC. But if you show up to the facility that you've chosen to birth at, and you say, I want a VBAC, and they say, well, we can't do that, and you say, why? It's because they don't have an operating room attached to their hospital. And one of the parameters for a VBAC is to have an operating room available in case they need it. Also, some providers don't do VBACs. So again, the place and the person can really affect that birth plan, and all of that work that you put into it is kind of just going to be scratched right off the table because it's no longer an option. Please make sure that you do a site tour. Make sure you make a list of things that are important to you and you bring them up with your provider at your prenatal appointments. Again, prep is really important. Knowing these things ahead of time is going to give you the best chances at that successful, positive birth experience. So that's my list. What's on your list? What's something that nobody told you about birth that you really, really wish that they had? If you missed the first installment of Nobody Told Me Pregnancy Edition, you're going to find that beauty right there. Show this one some love, and as always, be happy, stay healthy, have fun. Bye.